Zang Fu, The Organ System of Traditional Chinese Medicine by Jeremy Ross. Page 250. This last chapter, Chapter 19. Conclusion. Review. Part 1. Surveyed the background to the theory of Zang Fu. Chapter 1 considered the essential differences between Chinese and Western thought and the great dangers of applying Western thinking, Western concepts, and Western medical terminology to Chinese medicine. Chapter 2 discussed the organizational framework of the body, the substances, Jinluo, Zangfu, and tissues. Chapter 3 studied the substances in detail, since an understanding of their functions, origins, and patterns of disharmony is essential to an understanding of Zangfu. Chapters 4 and 5 discussed the origins and patterns of disease. Part 2 was concerned with the individual Zangfu. Chapter 6 briefly looked at the origins of confusion regarding Western study of Zangfu, and chapters 7 to 11 discussed the functions, origins of disease, and patterns of disharmony of the five Zang and their paired Fu. General guidelines for choice of points were given for each pattern of disharmony. Chapter 12 briefly considered Xinbao, then examined various facets of the Sanjiao concept. Chapter 13 reviewed the Zangfu by observing how each pattern of disharmony originates from failure of a particular Zang function. Part 3 dealt with Zangfu interrelationships. Chapter 14 views Zangfu interrelationships in the context of yin-yang, substances, Jinluo, and tissues, and examined the types of interrelationships between Zangfu and the origins of disease. Chapter 15 looked at Zangfu interrelationships in terms of the emotions and considered the clinical importance and the treatment of various emotional disharmonies. Chapter 16 investigated the patterns of disharmony of 11 Zang pairs, then considered disharmonies of 3 or more Zang together, especially in the areas of emotional disharmony, digestive problems, and gynecological and obstetric disorders, and finally looked at Zangfu interrelationships in some common disease patterns. Part 4 examined the application of Zangfu theory in clinical practice. Chapter 17 briefly dealt with diagnosis, treatment, and the education of the patient, and gave a simple sequence of clinical procedures. Chapter 18 studied 8 case histories of increasing complexity, which illustrated the application of Zangfu theory in clinical practice with actual patients. General. Chinese thought is not Western thought, and the Zangfu are not the organs of Western medicine. This book has discussed the functions, origins of disharmony, and patterns of disharmony of Zangfu in the context of TCM as a whole and in terms of interrelationships. This presents a very different picture from the physiology, pathology, and syndromes of the organs of Western medicine. The concept of interrelationships is absolutely fundamental to the theory and practice of Chinese medicine, and is a recurring theme throughout this book. All the manifestations of the Zangfu in health and in disease are based on patterns of interrelationships that change and develop throughout the life of the individual. The emphasis throughout has been on clinical practice. Theory has not been described for its own sake. Furthermore, although many practical examples have been given in the text, the only way that TCM can be learned is by many years' experience of applying the theoretical principles in the clinic. Only in this way is it possible to learn to differentiate the many possible permutations and combinations of disharmonies that occur in clinical practice. However, we do not deal with combinations of disharmonies. We deal with people, and the understanding in depth of the emotional, mental, and the spiritual needs of people lies outside the scope of this book. Teaching TCM. The aim of any course teaching TCM is to provide students with a clear framework of theoretical understanding and with the skills and techniques to apply these theoretical principles in clinical practice. This involves an understanding of the principles of Chinese thought and Chinese philosophy, without which there can be no true comprehension of TCM. The basic theoretical framework. The basic theoretical framework has been discussed and comprises a thorough understanding of the interrelationships between the following six categories: yin yang, substances, eight principles, Jingluo, disease factors, and Zangfu. There are other facets of TCM which should be studied, such as the six divisions, the classification of worm diseases, and the theory of the five phases. But compared to the basic framework of the above six categories, these are of relatively minor importance in the clinical practice of acupuncture. This basic theoretical framework is a central part of the courses run by the colleges of Beijing, Guangzhou, Nanjing, and Shanghai in the People's Republic of China. Eventually, it will become the common core of the curricula of the Western colleges. Each Western college may specialize in one or more aspects of TCM, such as 8 extra channels, stems and branches, or 5-phase theory, but it's essential that they share this basic common core. Traditional and Chinese. In teaching TCM, it's most important that the basic theoretical framework is both traditional and Chinese. If material from other countries and other cultures is mixed in with the basic TCM framework, then the student cannot fully understand TCM, and misconceptions will occur, reducing clinical efficiency. It's always best to learn one system at a time and to understand it fully before moving on to another. In the cases of TCM, it takes much time to assimilate and to practice properly, and the student must exert the patience and the self-discipline to do this before attempting to blend TCM with other systems. For example, the Japanese, Korean, and Vietnamese systems each have great value in themselves. But it is unwise to mix material from these systems with TCM in the early years of training. It's vital that students learn to diagnose, differentiate, and treat in terms of TCM alone so that they fully understand the theoretical principles and master the practical techniques before extending to other systems. Ambiguity. There are many areas of difficulty and ambiguity for the Western students in learning TCM. It's most important in teaching Chinese medicine that these areas are neither avoided on the one hand nor given hard and fast, clear-cut resolutions on the other. Flexibility and ambiguity are two of the greatest strengths of Chinese medicine, since medicine deals with people, and people themselves are complex, fluid, ambiguous, and always changing and developing. Theory and practice. It's vitally important in teaching TCM that there is not a great separation between the teaching of theory and the teaching of practice. Theory and practice are mutually dependent, and ideally, part of each day should be devoted to practice and part of theory. Part of the day spent in the lecture room and part in the clinic. Theoretical understanding increases clinical ability, and clinical experience strengthens and develops theoretical understanding. Theoretical principles only have life and relevance when they are manifested in practice. It's one thing to learn about a phenomenon in theory, and it is a very different thing to experience it in life. There's a great gulf between merely knowing something intellectually and having that knowledge embodied by experience. The concern of TCM is not merely with theory, but with experience and with people. Thanks for listening.